What types of cancer do people get? You can see that the vast majority of people who get cancer will get skin cancer, and then lung cancer, and then all these other cancers are a part of the mix as well. So skin cancer is by far the most common
Rhonda, you said we could interrupt you, right?
Anytime.
Could you go back one slide?
Of course.
I don't see anything about blood cancers. And from what I understood, that's a pretty high incidence also. Is that not on here for a reason, or?
So here I'm talking about, in this particular, I'm talking about solid cancers.
Okay,
Okay?
gotcha.
But yes, it is true.
All right,
And we will talk about those things as well.
thank you.
Okay. So the most common by far is skin cancer, and particularly basal cell and squamous cell cancer. Basal cell cancer is 10 times greater in transplant recipients versus the general population. Squamous cell is 100 times greater than in the general population. Most people develop these cancers on exposed areas like your face, your neck, your arms, places where UV light can get in touch with your skin. Most of the people have lighter complexion. Most people develop between 2 and 3 years after transplant. And we talk about skin cancer all the time, but we rarely talk about lip cancer. And those two go hand in hand. Skin cancers are more aggressive in the transplant recipient than in the general population. 5% of transplant recipients with skin cancers die from the skin cancer, and that's 5 times greater than in the rest of the population. And getting multiple skin cancers, the rate of that is actually quite high. Half of the people get multiple skin cancers. And some people, you remove a skin cancer in one area and it grows back in that same area. Or some people will develop dozens of cancers.
I have a question.
Sure.
Like, would eczema be like a skin cancer?
So eczema is a skin condition, and it can be very dry and you get flaky skin, but it isn't a skin cancer. And most people who have eczema, if you give them medicine and you treat it, it actually tends to get much better, and it never forms any sort of cancer.
Because I had it before.
So I'm happy to tell you that that I don't think you should worry about that.
Okay.
Okay. You can barely see this, but these are all the types of cancer that people get post-transplant. And again, generally speaking, the vast majority of the tumors tend to be solid tumors. And then down here, you'll see things like the blood tumors like leukemia and multiple myeloma. But lung cancer and PTLD are the things that people get. Okay?
Speaking of what, PTLD. PTLD.
Yes.
What is it?
What is that? It's post-transplant lymphoproliferative disorder, because we like to use big words, okay? And I promise there's a slide that's devoted to PTLD, because it's actually really important here.